Hello there, and a very warm welcome to today's MORPh podcast on supporting you in your PCN Clinical Pharmacist role. My name is Darshan Negandhi, and I'm a PCN Clinical Pharmacist in Southwest London. I'm also a MORPh Associate. To kick things off, I'll be giving you a brief outline on the aspects of structured medication review and how MORPh training can support you in conducting these confidently, competently, with a patient-centered approach. Now, MORPh training is available on a variety of different platforms and mediums, traditionally face-to-face, locality-based, but have been repurposed using digital platforms to meet the needs of pharmacy teams during these difficult times. Apart from live interactive webinars, these sessions are recorded and available to delegates on their MORPh accounts. And members are also able to access the recorded sessions on the MORPh educational platform. We have a variety of different live support and discussions that are expert-led on a variety of different therapeutic areas on Telegram. Again, supporting you in managing your patients. So let's begin. Now, the SMR part of the PCN DES contractual requirement came out this year, and the final guidance on SMRs came out in October, gave a real more specific, detailed guidance on the ongoing strategy, implementation, and principles of delivery. Now, if you haven't already had a chance to read it, I strongly urge you to do so. So how did the structured medication reviews come about? Well, as you know, medicine safety is becoming more and more of an important talking point in the healthcare landscape, with patients taking a variety of medications and some with complicated comorbidities. The impact and administration of these medicines need to be reviewed in much more detail. Over and above the fact that GP appointment time is shortening, and with remote consultations giving patients even more access to their GPs to discuss acute conditions, there is now a need for other healthcare professionals to take up the mantle of monitoring chronic diseases and regular medication. Having a more diverse and varied multidisciplinary team in GP practices is helping to manage the workload, but there is still more work to do. One of the goals set out by NHS England's Network Contract Direct Enhanced Services in March 2020 was for pharmacists and GP practices to take a leading role in conducting structured medication reviews. Now, these SMRs are designed to optimize patient outcomes and pick up on chances to deprescribe or intervene on medications that may be a cause of side effects. They are different from that of standard medication reviews that are currently being conducted in general practice by having specific target groups and taking up more time. Now, potentially, structured medication reviews can take up any time between 30 to 45 minutes, although there's no set benchmark that has been stipulated, and there may be a need for multiple interactions with the patient depending on the complexity. The specification summary stipulated the use of risk stratification tools to help identify prioritized patients who would potentially benefit from having a structured medication review. Now, these groups included patients in care homes, patients with polypharmacy with 10 or more medication, patients on high-risk therapies, patients with severe frailty, and those on opioids for pain management. And where the PCN clinical pharmacist capacity allows, and where the patients are not covered by the criteria, the PCN should also consider offering structured medication reviews to other patients that they think would benefit from such an intervention and review, including those who are prescribed multiple therapies, but fewer than 10, and other potentially addictive therapies also. The limiting factor in this workstream, of course, is the pharmacist. And because once the patients have been identified through these tools, it's a case of basically getting on with this workload and ensuring the appropriate amount of time being allocated for that particular patient to give them a holistic approach to their therapy. And although the actual numbers of structured medication reviews needed haven't been stipulated, there's a massive variability between surgeries and can be anything between 3 to over 10 structured medication reviews in a week, really depending on the focus of that particular surgery. The use of risk stratification tools such as searches is a form of proactive identification of patients where you are actively looking for those at risk. The alternative means of identifying patients is through reactive structured medication reviews. And they could be through a crisis or an incident, such as admission to hospital or a fall. It could be a personal concern of the patient, or it could be a professional referral, or even a request for a compliance aid as a means of managing multiple therapies to trigger reactive structured medication reviews. So, who can conduct these structured medication reviews? Well, in accordance with the PCN DES, it's been stipulated that only appropriately trained clinicians, specifically PCN clinical pharmacists who are undergoing training as part of the CPP pathway, but also independent prescribing pharmacists and individuals with advanced assessment and history taking skills, such as advanced clinical practitioners. So what are the key principles to consider when carrying out a structured medication review? Well, first and foremost, it's a shared decision-making process. So the patients are supported in making the best decisions about which medicines they should and should not be taking. The final decision to prescribe or deprescribe must be based equally on the clinical evidence, the clinician's experience, and the patient's lifestyle, ideas, concerns, expectations, and their own wishes. We also need to have a very individualized and a very personalized approach so we can tailor it to the specific needs of the patient. A question that might come to mind would be, how would the patient like the medications to impact on their quality of life? What would the patient like to get out from the structured medication review? Or what medication is a patient taking or not taking, and why? So these sort of questions need to be addressed. Also, we need to look at how they understand it, their information about the medications from a health literacy point of view. So as part of a shared decision-making process, agenda that was publicized in the King's Fund of 2011, it coined the vision, which was articulated by the then Secretary of Health, Andrew Lansley, in the phrase, "Nothing about me without me." And this still holds true today. And then finally, we're looking at the safety. We need to consider the balance of benefit versus risk. Is the patient experiencing any side effects? So really, this is an opportunity to work as a multidisciplinary team across primary care, as well as community services such as community pharmacies, in order to refer patients for NMS, utilizing the skills and expertise of the community pharmacist to reiterate and support the patient on their therapy in accordance to the specifications of new medicine services. I hope this has piqued your interest. And if you'd like to find out more on how to join and book your next session by visiting the MORPh website, you can also follow us on social media and subscribe to our mailing list to continue your learning on structured medication reviews and other aspects of the PCN DES. Join our 2021 PCN Support Webinar. And why not become a member of the Primary Care Pharmacist Training Network on the MORPh website?